So how exactly does menopause affect a woman's heart?
So I get this consult in my office
I'm sure.
probably like 5 times a week.
Yes, and you probably have to sit there for more than half an hour to talk about this.
But I don't mind because no one else is talking about
You're
this
so
with
sweet.
patients. I really don't.
She's so nice.
So what happens in menopause is, unfortunately, as you have dips in the estrogen, you get a redistribution of body fat. Unfortunately, you gain some weight, increase your cardiovascular risk just by weight alone. Blood pressure tends to go up, and also cholesterol changes as well. So less protective of the HDL, worse LDL, and this is also related to the estrogen effects, and we know this. So, and then women do feel changes in their vasomotor symptoms, the hot flashes, the anxiety, and may think that they're dying. I have so many patients that what they really need is to be worked up, exclude major problems, that provide some reassurance, and then we troubleshoot and treat menopause if we need to. That opens a whole nother can of worms.
That's the problem. Now
Right.
you're talking, let's treat menopause, and then you start going into, which is another discussion, and we've had this discussion on our show, which is, you know, do you take hormone replacement therapy? Do I not? That's just another host of issues. That's like
Right.
another book.
Yeah, I mean, briefly, I would say that a cardiologist is needed to assess their cardiovascular risks. If a woman is high risk for cardiovascular disease or has known coronary disease, I would say supplementing estrogen is dangerous because it can increase the risk of cardiovascular disease. But there are plenty of women who are going through menopause who are not high risk. They use a little bit of supplementation for a short period of time. It probably is okay and well tolerated. But there are other risks of being on hormones, like clotting, DVTs, PEs, cancer risk. So I don't view hormones as benign. I actually like to use more like SSRIs, antidepressant, anti-anxiety medications to help manage some of the anxiety, the hot flashes, because those medications are safe for heart disease, and they've been shown in studies really to help with those kind of symptoms.